we are talking about the Quad AAAASF certified suite that we have at Contour Dermatology. The Quad AAAASF is a unique accrediting agency, and it is in place to protect patients in an office-based surgery setting. They have multiple requirements. All of our surgeons have to have hospital privileges for any procedure that is performed in the suite. Anesthesia professionals for deeper levels of anesthesia is needed, and safe surgical environments, equipment, drugs are logged and checked through specific standards. The office-based surgery they're actually held to hospital standards, so we have to be just as good as a hospital. And we do require peer reviews, and they do track all of our data. If we have any type of complications or deaths or anything that happens in the facility, we do have to report, basically. And its primary mission is to ensure the highest quality for patient care in the ambulatory surgery setting. And the Quad AAAASF was established in 1980. They have been recognized as the gold standard of all outpatient settings. The vast majority of ambulatory surgery facilities are not accredited, so we're one of few here. But it is becoming a growing number of states throughout the country, however, are recognizing the need for mandatory accreditation. So it is going to be enforced as time goes on. And they are the forefront of all efforts to provide patient safety and quality. So for patients, there's more than having just the surgery. You want to make sure that the place that you select is basically qualified and that they do have the greatest patient care available. And the AAAASF was designed to help protect patients and assure that safety and quality is provided with them. And they must meet, or we must meet certain standards for the nation, and that includes equipment, the safety that we take in the operating room, and the credentialing for all personnel in the surgery suite. And they have developed a system to monitor and implement all of these standards and to deliver advanced benefits to patients. And for us, we need to meet certain requirements. We must comply with all of their local, state, and federal regulations. We have to adhere to their federal laws, and that's including the OSHA, the HIPAA, the American with Disability Acts, and we have to utilize advanced instruments and monitoring devices for patients, so we have to have the latest technology in this surgical suite. And for our surgical suite, it is in room 10. Our hours are 2 p.m. or later on Monday, Wednesday, and Friday, so this room cannot be used for any other purpose at these times. And our hallway traffic must be kept to a minimum, so when we're using this suite, we have to direct patients elsewhere. They cannot use the restroom down here. It has to be minimal as possible to reduce infection. When you're in the room, you have to wear surgical hats, you have to wear masks, goggles or glasses, and also gowns. We have surgical gowns in there as well. You have to use hand hygiene. It has to be done in the beginning of the day, of course. You have to do it throughout the procedure. Anytime you take off your gloves, you have to sanitize or wash your hands. If you touch something, if you touch the door, the wall, anything, you have to sanitize your hands. And then patient vitals, they're actually very strict on this. You have to take the patient vitals at their pre-op visit because we need to have something to compare with at the day of their procedure. We take their blood pressure, respirations, temperature, the O2 stat. You also have to listen to their lungs, and if they are under sedation, they will be monitored every 5 minutes and recorded as well. And our narcotics, they are kept in a double locked box. Only nurses and doctors are able to retrieve the medication, and it does require a double signature. All syringes and needles are not to be accessible to patients, so they actually cannot be kept in the room unless we have a locked cabinet. Right now we don't have anything in the room. We go elsewhere to get everything that we need. We're not allowed to have pre-filled syringes, so no lidocaine, no open vials of any kind. The counters must be cleared. There cannot be anything except the sharps container on the counter and glove boxes. And all of our equipment is inspected annually, of course, and calibrated if needed, but we also inspect the equipment each day of the procedure to make sure everything's in good standing. Temperature has to be kept between 72 and 76, and all logbooks must be completed for every procedure. And for medical assistance, we have to always, before the procedure, we need to check the room temperature, and we have to check the medical fridge, the AED to make sure that it is working. If it's not working for any reason, we're unable to do the procedure. We have to reschedule. Crash cart medications have to be checked, and deep cleaning of the room pre and post procedure has to be done, and it all has to be logged as well in the logbooks. Items that we check weekly are the eye wash kit, which is located in the nurses station, the battery backup, crash cart, and narcotics. We do a weekly count on the narcotics to make sure that nothing is missing.
This is something we've sort of been lax about in the past. We just sort of kept them in a bottle and sometimes in wine. Now we have to be like strict on every single pill that leaves that box has to be accounted for. Does every pill need to be double signed?
It states that what Tamar told me is that we have to have a double signature on anything that's being signed out and added or discarded. So we've been doing one for.
Okay, so if it's being discarded.
And services have to be kept up to date, and fire drills must be completed monthly. And in our nurses station, we do have a clean and dirty area. Basically, in the clean area, nothing can be there except sterilized instruments. Nothing above the clean area basically no cardboard boxes, only liquids or plastics in that area, and there cannot be any type of clutter. And the dirty areas where we wash instruments, where we can package instruments, mix medications, and do what we need to do to stock rooms and do all of that. But we cannot cross-contaminate because there is a little divider, so we want to keep that area clean. And our ultimate goal is we want to assure our patients that at Contour Dermatology is providing the highest level of safety and quality in all aspects of the service throughout their outpatient surgery experience. So that's why we have this certified suite. And that's it.